My name is Aaron Zolbrod. Thanks for joining us on the Health Insurance Store podcast, where we take on the entrenched status quo of our nation's healthcare system. Our goal is to stimulate transparent conversation on everything associated with healthcare. We want to guide our listeners through a system filled with deliberate obfuscation while protecting your hard-earned money. We appreciate you being part of our initiative to bring clarity and compassion to healthcare. Welcome. We are super excited today. My name is Aaron Zolbrod. I'm the president and founder of the Health Insurance Store, founded in Connellsville, Pennsylvania, Fayette County. We're very excited for a couple reasons today. Number one, this is our first ever webcast, so you're going to have to excuse me. I've been told I've got a face for radio and podcasts, and that's what I've done for the last 12 years is just radio and podcasts. So I've been interviewed a couple times on camera, but this is the first time I've ever done a webcast. So hang in there, guys. Turn your monitor off if you don't want to see me and just listen to what we got going on. But in case you haven't tuned in before, what we do here on the Health Insurance Store podcast, now webcast, is we discuss everything that's ongoing in the healthcare field, and we're especially in tune with what goes on with seniors, especially people on fixed income. How can we save you money? What's going on with prescription drugs, Medicare Advantage plans, supplements? We want to help you. Okay, that's what I've been doing for 13 years. The Health Insurance Store was founded in April of 2008. We just had our 12-year anniversary. We've helped well over 10,000 seniors make their choices in Medicare plan, help them advocate them when they have issues with prescription drugs, with bills, et cetera, and that's what we strive to do at the Health Insurance Store. You can visit our Facebook page. You can go to our website for more information about what we do. Our mission statement, that's www.getyourbestplan.com. You can pick up the phone and call us, 724-603-3403, 724-603-3403. What we do on our podcast and our weekly podcast, and now again, webcast, is I do a column in the Pittsburgh Post-Gazette that runs every Friday on page A2. It's called Ask the Medicare Specialist, and that also runs in the Tribune Review on Tuesdays on page A7. We've been doing that for about 3 years now, and it's been unbelievably popular. And so what I decided to do is I like to take the question that we get each week, and I like to get more in-depth with that. So we're going to talk about the question we got a couple weeks ago. I'm a little bit behind just because we had some equipment that was being set up and so on and so forth. But, I said I was excited for a couple reasons. And again, number one, first webcast ever. Number two, I've got an absolutely huge announcement for people who are diabetics, who are taking brand name medications and have found themselves in the donut hole and found themselves in a position where they're really having a hard time affording those medications. So that's what we're going to talk about today. It's very important. This is one of the most important events since PaceNet raised their limits for extra help, and we're going to get into that. So here's a question I got a couple weeks ago. It says, I saw your Facebook post regarding a foundation that is supposedly going to provide several diabetes medications for free. Can you confirm and explain the program in details? And my answer is it's true. And again, one of the most important, exciting pieces of news since PaceNet raised their income limits almost 2 years ago. PaceNet is a program for seniors that helps people afford their medications, but the income limits, aren't nearly as high as the income limits for these programs we're going to be talking about. Now, since I wrote this column, we discovered we even got some better news, and we found out that there's more than one foundation that is providing these medications for free. And we're going to talk about that as well. But, a couple of the largest biotech and pharmaceutical companies in the world, again, one has announced some changes and one made some changes to what's called their patient assistance program. And those are programs that they put out that help people, again, who are generally in their prescription drug donut hole, afford their medications. But these programs are going to immediately provide those on Medicare several commonly prescribed and very expensive diabetic medications for free. And, one company, it was their way of giving back during the COVID pandemic. I'm going to, kind of make fun of them a little bit because, it kind of sounds like they're struggling in some ways making money by doing this. But anyways, prior to this announcement, in order to qualify for these free medications, and again, patient assistance programs are generally funded by those prescription drug manufacturers. So you're talking about AstraZeneca, Merck, Lilly, Novo Nordisk, Johnson & Johnson. I mean, big, big, big companies. They make, when I say a gazillion dollars, I guess that's a little, but we're talking billions of dollars a year net profit these companies make. So they put up the money for this, or I guess not put up the money, but they're providing medications for free. And again, prior to the announcement, couple milestones had to be met. The first one is one's donut hole, which we're going to explain, had to be met first. And then once you met the donut hole, that wasn't enough. You had to have spend anywhere between $900 and say $1,600 to $1,800 out of your pocket before they would provide these medications for free. Well, that's not a huge help for people, because someone who shows up at the pharmacy, last month they're paying $40 for their Humalog, and they show up, the following month and somebody says that'll be $135. Somebody might faint, and that's for 30 days. So again, we're going to get into this. So those are the things that had to happen. Listen, that's no longer the case with a lot of medications, which is just a fantastic development. And the bottom line is this, with the exception of one of these medications, we're going to show you this list here in just a minute. Prior to that, this is all that needs to happen. Excuse me. Sorry for stuttering. Any household with an annual gross income that's under 400% of the federally poverty level qualifies, period. Now we don't need to worry about being in the donut hole. We don't need to worry about how much money we've spent already on medications to get these drugs for free. If you qualify financially, you qualify to get these medications for free. We're going to talk about them in just a second, but I want to give you those income limits first. Income limits as follows: 400% of the poverty level for a single person, $51,040, and it's $68,960 for a married couple. And this is important as well. Keep in mind, whatever assets you have, I don't care if you've got a checking account. I don't care if you've got a 401k with $400,000 or $800,000 in it. I don't care if you've got property, if you own, if your wife's got a safe full of jewelry and diamonds somewhere. It doesn't matter. Checking account, stocks, bonds, 401k, doesn't have any impact on qualifying, which is fantastic news, okay? So again, those who are accepted can have their medications shipped out as little as 2 weeks according to some of these program guidelines. And I'm going to show you the list of the medications here, okay? This is with 3 different manufacturers, okay? So here is that list. Insulin, we're talking about Tresiba, Levemir, Novolog, and Humalog. Now, the newest thing that's coming out now are what we call non-insulin injectables. And these are even more expensive than insulin. I mean, they're just ridiculously expensive, drives me crazy. I'm going to go out on a limb here and say the introduction of these non-insulin injections that range from $700 to $1,000 for a 30-day supply. Amazingly, they came out just prior to some of insulins that are starting to now go generic. And again, you're not going to want to get... I'm not fans of big pharmaceutical companies. You're not going to find me saying very many complimentary things about them. Really bothers me. But again, these are the latest and greatest, right? Victoza, Ozempic, Novolog, excuse me, I got that wrong. Novolog is listed in Trulicity. Excuse me, Novolog and Novolin should not be listed here, folks. They should be listed up here with the insulins. The Novolin should be in there, so excuse me. So it's Victoza, okay? It's the Ozempic and the Trulicity. Those are the non-insulin injections, and I apologize for typing that up wrong. The one thing that strikes me, the Ozempic, right? You see that commercial, oh, whoa, whoa, Ozempic, excuse my singing, right? Where these people, they're making diabetes sounds like it's fun, okay? It's not fun. Diabetes, I don't know. Somebody can call me and tell me differently that it's fun. It sure isn't fun when you got a copay for $250 after you hit the donut hole. That's no fun either. But again, these medications right here, and then here are type 2 oral medications that you can get for free immediately if you qualify. Januvia, which is very expensive, around $500 a month, and Jardiance. This is the only medication. This is a different foundation, different manufacturer. They have a 300% income limit. So that income would be 37% for $37,470 for a single person and $50,730 for a married couple. Where again, 400% of the poverty level is quite a bit higher. Again, if you're single and you make less than $51,040, if you're married and make less than $68,000, that's $960. for a married couple, you can get these medications for free. These are your insulins: Tresiba, Levemir, Novolog, Humalog, Novolin. Excuse me, I shouldn't have Novolog or Novolin listed under non-insulin injections, but Victoza, Trulicity, and Ozempic for free right now. And now, last month, May, is usually the month most people, May and June, meet their donut hole and have to pay more money for their medication. So we're going to talk about what the donut is in a minute, how much those drugs can actually be. So again, we have copies of these applications. We can provide you these applications to you. They're pretty simple to fill out. Your doctor needs to make an attestation that you are indeed taking them, that he or she is prescribing them. They need to be sent in, and then those drugs will be mailed to you rather quickly. They're not sticklers about the income, proof of income you provide. A Social Security statement, a paycheck stub will be suffice for them to get these to you. And again, these medications are extremely expensive. So let's talk about the non-insulin. Let's talk about those non-insulin injections that we just said: Victoza, Ozempic, Trulicity. The lowest priced is Levemir, retails for just under $500 for a 30-day supply, and the highest Victoza, almost $1,000, just under $1,000 for a 30-day supply. So I want you to listen to an upcoming podcast. We're going to talk about some of the reasons why. We're going to get some people in here and interview them on why these are so expensive. To be brief, the reason why they're so expensive is in the United States, we have something called pharmaceutical benefit managers, PBMs. Very controversial. They're basically the middleman between the drug manufacturer and the pharmacy. And all they do is basically mark the price up. They could mark it up $300, $400. So I looked up Victoza. Retails for $1,000 here in the United States. That's 30-day supply, folks. I think that's like 2 pen injectors that last a month or 3. Well, I looked it up in Canada, Canadian pharmacy that sells them. It retails for around $300. Why in the world are drugs in Canada, England, all over Europe, $300 a month, and they're $1,000 here retail? Well, most of it's due to these pharmaceutical benefit managers that just mark up the price, take a big, huge chunk of money. They're gazillionaires too, and they pass it on to you, the consumer, and they pass it on to the insurance companies, which ultimately is going to be passed on to your employer or to Medicare. You wonder why your Medicare Part D and B premium's going up? This is a lot to do with it. Hopefully, we're going to have some sort of prescription medication reform. Unfortunately, these events pop up, COVID and, the George Floyd issue and the police brutality issue and the protests. They kind of put these to the back burner. I think it's a shame. This is something that needs to be done. Our seniors are the most vulnerable members of our society, in my opinion. These are people whose income never goes up, despite products and services, goods and services going up. Their income doesn't. It's not like we can go back to work when we're 75, 80 years old a lot of times. So this is a huge issue that we need to take into account. So let's talk about the donut hole. We mentioned that, which brings me to the donut hole. The donut hole was supposed to go away. It was promised to us 8 years ago with ACA, Affordable Care Act, Obamacare, whatever you want to call it. We were always told, in 2020, donut hole's going away. You're going to get a discount on your medications. Starting in, I think it was 2014, you're going to get 25%. You're going to get a 25% discount. Then it went to 50%. Then it went to 75% once you're in the donut hole. Used to be you had to pay the whole cost. Well, supposed to go away in 2020, did not. Okay, that was a big fat lie. In fact, not only did it not go away, you have to spend more money when you're in the donut hole before you can come out of it in 2020 than you did in 2019. I'm going to tell you, pick up the phone, call your state reps, call your senators, call your congresspeople, ask them, wait a minute, why didn't the donut hole go away? We were promised it was going away. Why didn't it? Give me an answer. What are we doing about the high cost of prescription medications? Because they just keep going up and up and up and up, and your income, your Social Security, we might get a 1.6% increase, a 2.6% increase. Yeah, well, that's great, except they raised the price of Part B, as in boy, and your supplement went up, and your raise, it just poof, it went away. Sometimes it's not a raise, it's a decrease. So we need to get our representatives asking us, why were we told the donut hole was going away and it's not? Anyways, let's talk about it. Those on Medicare can only receive $4,020 worth of prescription drugs in a calendar year. This is retail now. Has nothing to do what you paid. Has nothing to do what your copay was. It is only what that drug costs, what you pay for them. Again, copays, coinsurance, deductibles, has nothing to do with that, okay? Only the actual cost does. So, for example, we talked about retail for Victoza is $1,000. Well, how long is it going to take at $1,000 a month for you to exhaust $4,000 worth of prescription drug costs? It's going to take you 4 months, and that's if the only medication you're taking. If you were taking Victoza, and Eliquis, which is a drug that's probably the most widely prescribed brand name drug in the country that's not diabetic medication, you're taking $1,500 worth of medication. You're going to hit your donut hole in less than 3 months. Once you hit the donut hole, your copays increase from an average of $35 to $45 for a 30-day supply of medications to 25% of the cost of the retail. 25%. The poor person who's taking Victoza, that comes to $250 for a 30-day supply when you're in your donut hole. And you would have to pay that normally until you spend about $2,200, $2,300 out of your pocket before the federal government will come back in and help you pay for your prescriptions again. Well, by the time people get to that point, the year ends, and guess what happens when the year ends, folks? When the new year starts, it all starts over. Your donut hole starts over. How much you can get in prescription starts over. Most people, if they get in what's called, once you get out of the donut hole, once you've spent that $2,200, $2,300, you fall into what's called your catastrophic coverage. And, people hit it, get in it, and you only have to pay 5% of the cost of medications then. So the Victoza would be $50. Still not cheap. But it only lasts a couple months before the year starts again. So, again, that's tough. But listen, let's go back. You don't have to worry about that anymore. If you make less than $51,000 as a single person or $69,000 as a married couple, we can get you these medications for free right now. I had somebody email me a couple weeks ago and said, do I need to buy your insurance for you to send me that application? And I kind of chuckled because, I get it. You're wondering, why would I do this? Give these applications. No, you don't have to change your insurance. You don't have to get your insurance through the health insurance store for us to give you these applications again. I've watched people struggle since I started in this business 12 years ago when they get in their donut hole. I've watched them. I live in Fayette County. We're the second poorest county in the state. My clients worked in the mills, worked in, did a lot of blue collar jobs, didn't have the money to invest in stocks or bonds, or now a lot of us have 401ks. These are people that are living on Social Security and a small pension. They may be living on, $1,800 Social Security, a $500 pension, $2,300 a month, $2,800 a month. And that's it. I've watched people struggle with this for years and years and years. And I want to help people. I want to get you these applications if you qualify. So all you got to do is call into the office, email us, email me personally. My email is Aaron, Aaron at getyourbestplan.com. That's also our website, getyourbestplan.com, GETYOURBESTPLAN.com. Okay. Again, we talked about this prior to us discovering a Assistance Foundation waiving that $1,000, and there's still companies who don't, manufacturers don't, but you had to spend $1,000 or more out of your pocket before they give you the medications for free. Again, they're going to give them to you right now for free. We'll send you out that application. All you need to do is call us, email us. We'll mail it to you, email it to you, and we'll keep tabs on this. Hopefully, they're not going to waive that $1,000. But there are a couple companies that supposedly told us they never had it, but that's news to me. But again, let's go over those medications again. So insulin, Tresiba, Levemir, Novolog, Humalog, and which I've listed here, and Novolin. I listed those two under non-insulin dependent, non-insulin injections. That should only be the three: Victoza, Ozempic, Trulicity. And then these are some expensive brand name type 2 medications, Januvia and Jardiance. That are also very expensive. And Jardiance, again, has a 300% income limit. So let's go back. We'll keep listing those again. And listen, if you don't see a medication on this list, almost every single medication has a foundation to help you. But again, a lot of them, I had a client that had a medication that was $1,400 a month. It was also, I forget what kind of medication it was, $1,400 a month. They had to spend 4% of their household income out of their pocket, which was $1,600 in this case, before they get them for free. But hey, better than not having it at all. So if you got a medication that you didn't see on this list, we know all these patient assistance programs, Eliquis, which I mentioned, we just talked about today, that can be free of charge once you've spent $900 out of your pocket, which is not terrible because it's still going to save you $15. Again, the average person is going to save between $1,000 and $3,000 with these programs, which is a huge deal. I'm hoping that other pharmaceutical companies will imitate what Novo Nordisk did, waiving this money, but we'll see that. Again, I'm going to keep track of it. I'll let the public know. You can keep track of all these types of things on our podcasts, our webcasts, reading the columns if you've never done that. My advice is this. If you have a prescription drug that's very expensive, you need to have a plan in case these foundations go away, in case something happens. First of all, I don't think anybody wants to be a diabetic. I don't think anybody wants to be on insulin, wants to be, poking, holes in their arm, to test yourself, to inject these things. There's several options you have, okay? Number one, I'd ask your doctor if your A1C has dropped significantly since you started taking insulin or you started taking these non-insulin injections, Victoza, Ozempic, Trulicity. Has it dropped significantly since starting them? And if possible, can we come off them? So what if my A1C hasn't dropped that much? Hey, doc, is this really necessary? I have to pay a $400 deductible. I have to pay a $45 copay. Do we need to keep doing this? Could diet and exercise be an alternative? Do you qualify for PaceNet? PaceNet, if you qualify for PaceNet, we don't have to worry about applying for these prescription assistance programs. That income is less for a single person. It's $29,120, and married couple $38,740. So you can see the difference. We're talking about $30,000 difference almost. $21,000 for a single person, $30,000 for a married couple. But if you do qualify for PaceNet, again, $29,120, $38,740. We don't have to apply for these programs anymore. And these programs run from year to year. For some of these, for the Tresiba, the Levemir, the Victoza, and Ozempic, it's only going to run from this to now until the end of January or to the end of December. Then you're going to have to reapply. Other companies, it's 1 year from the time you apply. So it all depends. We can help you with that if you have questions. But, have a plan and process. Try to get off these medications. I don't think we communicate with our doctors enough. A doctor says, I'm going to put you on this medication or that medication. Hey, doc, why? Because, we think it works. All right, doc, is there anything generic we can take? Well, this medication doesn't come in generic. I get that. All right? There is no generic for Victoza or Ozempic. There is no generic for several insulins. But is there a generic that treats the same condition that I could be taking that would be less money? We don't do that enough. I'll never forget, it was, I don't want to say it's 8 years ago. I'm 50 years old. I'm 41, 42. My doctor says I got some high cholesterol, which runs in my family. My father's 87 years old, lived with high cholesterol his whole life. It doesn't matter what he does, he can't get it down. He takes statins and everything else, eats really healthy. And doc says, I got to go on a statin medication. I'm 41 years old. And he says, and you're going to have to go get your liver enzymes checked every 3 months. You're going to have to quit drinking. I said, well, doc, I kind of enjoy drinking a little bit. I'm kind of a Crown Royal guy. I like to sip on my whiskey once in a while. I like to have beers. I can't see myself. And I don't want to take anything that's going to, I drink booze and nobody tells me I need to go get my liver checked every 3 months. I said, I'm not taking it. I'm going to try flaxseed. I'm going to try to eat healthier. I'm going to try to exercise a little bit more. I'm not doing it. Because I've heard statins cause a lot of side effects. I'm just not doing it. So again, I just say question. And another thing you can do is use your pharmacist as a sounding board. Ask your pharmacist for advice. Listen, I love my doctor, Dr. Cole. I love my doctor before him, Dr. Dixit. They were wonderful men. God bless them. They didn't go to pharmacy school. They went to med school. Some of them went to med school 30 years ago. Your pharmacist went to pharmacy school. So I will go to my pharmacist, or I'll recommend people go to their pharmacist and say, listen, ask your pharmacist if there's an alternative to X medication that's brand that they think is safe and could work. Then you take that back to your doctor and say, hey, talk to my pharmacist. He or she mentioned this. I've had several people told my doctor, gave me the new prescription for the generic medication, saved me thousands of dollars. So again, these are things I'm always thinking about. We're always thinking about here at the health insurance store. We're not doctors. We're not pharmacists. We're just going to throw this stuff out there. Hey, why don't you ask about this? Why don't you ask about that? I am so anal about saving my clients money. my people in Allegheny County, we have an office in Allegheny County in Pittsburgh. Sometimes I get people that are making $120,000 a year, and I'm trying to save them $10 here and $5 there. They're kind of looking at me like I'm crazy, but this is what I'm used to. We're talking about thousands of dollars with these programs, but I'm anal about saving my clients. If they can get their medication through GoodRx without using their insurance for $2 instead of paying their copay of $8, I want to do it. That's just how I'm built. Anyways, if none of these things are possible about, asking your doctor, can you get off insulin or off these non-insulin injectables, let's ensure you at least have the lowest cost Medicare Part D plan or Advantage plan every year. I can't believe how many people don't check on that, and they just keep paying more and more premiums for their Part D plan. My ex-mother-in-law, calls me up. She's having a hard time affording her supplement and her Part D plan. Well, I saved her $100 a month on her supplement. She has the same benefits. I found out she's paying $71 for a Part D plan. She should be paying $13, and the costs are not going to be any different or slightly different. We turned around and saved her $170 a month. So if you're spending a lot of money on drugs, well, maybe there's some places we can save you money to kind of level that out a little bit, in other words. So, again, if you want to do that, that's what we do all the time is we sit down with people. We're going to go over your Medicare Advantage plan or your supplement, compare benefits side to side. Can we save money by doing this and keep your benefits, the similar or exactly the same? That's what we do. Also, when you become a client of ours, you get an annual recommendation letter from us, which we check that for you every year and make sure you're always on the best plan. Even if you're not a client now and you want to be put on that mailing list, give us a call. We'll put the prescription drug plan or the Medicare Advantage plan or the supplement you have in our database, and then we'll follow up with you every year if we find out there's any savings that you can have by making some changes. So again, I know I got a little bit off topic, and the conversation's been about this, the great announcement in our discovery that there's a lot of diabetic medications, brand name medications that you can get for free immediately. I want to go over those one more time. Again, these are free right now if you make less than 400% of the poverty level. $69,000, just a little under $69,000 for a married couple, just under $52,000 for a single person. Tresiba, Levemir, Novolog, Humalog, and Novolin insulins. Sorry again, Victoza, Ozempic, Trulicity, and type 2 oral diabetic medications that are brand name Januvia and Jardiance. Jardiance is the one medication on here that you're seeing that has a little lower income limit than the other ones. But, all but one, 400% of the poverty level, fill out the application, get them the documentation they want, which is simple to do, and they'll get you your prescriptions mailed out right away. So again, if you have questions regarding the program, any of these programs, didn't see your medication on here, would like to check on it. There's a gazillion other brand name medications that are expensive. Almost all of them have patient assistance programs. We can find those for you, give you the details, give you the applications. Call one of our offices, 724-603-3403, 603-3403 is our Connellsville office, our flagship office. We also have an office in Forest Hills in the Pittsburgh area. Any of you listening, we have one in Erie. I don't know if we got any West Coast people, Albuquerque, Santa Fe. We actually have an office in New Mexico. Long story. Not going to get into it right now. We do have an office in Albuquerque, but you can email me at Aaron, Aaron, at getyourbestplan.com. You can check our website, which is getyourbestplan.com. We'll be happy to talk you through the process. And as always, I didn't mention this the whole podcast, whole webcast now. We never charge for any consultations. We won't charge you to send you these applications. You don't have to change your insurance. And we also don't charge for consultations if you're going on Medicare for the first time or you'd like to get a consultation to go over your plan. You don't have to wait until October when the annual election period starts. If you're on XYZ insurance and you're saying, man, I've been wanting to do this, we can meet you before that. Just because you can't make a change today doesn't mean we can't sit down and prepare you for that day when it comes and say, look, you're paying $172 for this plan. Your copays are higher for this service, that service, and you're missing out on some dental and vision. What are you doing? You don't need to be. You could be paying $45, not $172. You could be on supplement plan F, which we think is a total waste of money. We could say, look at G and N. They're $75 to $100 a month less money. you're basically, all you're doing is going to pay $200 in medical bills that you don't with Plan F, but you're going to save $1,200 in premiums. That's kind of a no-brainer, but that's the stuff that we do. Let me tell you, go to our website now. You can go to our website where you can listen to all the podcasts, and then you can subscribe to them for free. You're going to click on the podcast gallery, which is in the top right-hand corner of our website, and then you're going to get to another tab. You're going to click the follow tab. You can type in your email, and then they'll email you every time when we have another podcast, that we're doing, or another webcast that comes up. And we're going to be doing a lot of those. Again, I was a little late in getting to some of these due to the new equipment that we were getting in. So you can go back and hear archive podcasts, what the titles are, differences between Medicare Advantage plans and supplements, which is always, always so important. And we look forward to seeing you guys next time. And we hope that you will join us very, very soon. And excuse me while I reach over and try to figure some of this equipment out. But again, guys, thank you so much for tuning in, and we will see you next time. Thanks for listening, folks. Join us again soon as we interview those on the front lines of healthcare, health insurance, Medicare, and our ongoing prescription drug crisis. My name is Aaron Zolbrod, and we look forward to helping you get your best plan at the health insurance store.